You know, when most people hear hyperbaric oxygen therapy, they probably think like deep sea divers, right?
That's the common image.
But what's really surprising, I found, is just how many different ways it's being used all over the world.
Oh, absolutely.
Stuff like wound healing, maybe even stroke recovery. It's
Yeah.
fascinating. So, okay, let's try and unpack this whole world of high pressure oxygen.
Yeah, just sounds good. So essentially, hyperbaric oxygen therapy, HPO for short, it just means breathing pure oxygen inside a special chamber.
Yeah.
Under pressure.
Right, more pressure.
Exactly. And that increased pressure lets your body absorb way more oxygen than, just breathing normal air.
Okay. And for this deep dive, we've really gone through the medical literature trying to get a proper handle on HBO therapy. Our goal today really is to get past that initial, oh, wow, pressure chambers thing and figure out, okay, when is this actually used? When is it a good idea?
And when isn't it?
Yeah, exactly. And what are the risks, the complications you need to know about? Whether you're, a medical pro or just curious, we want to make it clear.
And we've been focusing on that medical literature. So scientific evidence, treatment guidelines, potential problems, that kind of thing.
Okay, let's get straight to it then. When is HBO therapy actually, the accepted treatment?
So in the U.S., there's a specific group, the Undersea and Hyperbaric Medical Society, UHMS,
Okay.
and they have a very specific list. They actually emphasize it's quite limited.
Limited, okay.
Yeah, these are the conditions where they feel there's strong proof from controlled studies. So these uses have real scientific backing.
Right. Credibility. So what's on that list? Let's go through it.
Okay, first up, air or gas embolism.
Bubbles in the blood.
Exactly. If you've got air or gas bubbles trapped where they shouldn't be, the pressure helps shrink them down so they can be reabsorbed safely.
Makes sense.
Then there's carbon monoxide poisoning. That's a really key one.
CO poisoning. You hear about that.
Right. And that includes cases complicated by cyanide poisoning, too. Basically, HBO helps flush out the CO, get oxygen back where it's needed, fast.
That sounds critical. Really life-saving stuff. What else?
Clostridial myonecrosis. You probably know it as gas gangrene.
Oh, right. Nasty infection.
Very nasty. The high oxygen levels actually fight the bacteria. Then, compromised skin grafts and flaps.
So when a skin graft isn't taking well.
Exactly. If the blood supply is poor, that extra oxygen can make a huge difference to healing.
Okay.
Also, crush injuries, compartment syndrome, where swelling cuts off blood flow.
Yeah, like intense pressure buildup.
Right. And other acute traumatic ischemias, basically situations where blood flow is suddenly severely cut off.
So for all those, it's about getting oxygen to tissues that are desperate for it. Starving, basically.
Precisely. Then decompression sickness, the classic one people think of.
The bends.
That's it. The controlled pressure helps manage those nitrogen bubbles from coming out of solution too fast.
Got it.
Enhancing healing in certain problem wounds. Think diabetic foot ulcers that just won't heal with standard care.
Okay, that's a big area.
It is. Also, exceptional anemia from blood loss. Like,
Yeah.
if someone can't get a transfusion for some reason.
Ah, interesting. So it helps the remaining blood carry more oxygen.
Exactly. And finally, intracranial abscesses, infections inside the brain.
Wow. Okay, that's already quite a list of serious conditions.
And we're not quite done with the approved list yet.
Okay. More.
Just a few more. Necrotizing soft tissue infections. These are really aggressive infections spreading through tissue fast.
Like flesh-eating bacteria.
That kind of thing, yeah.
Yeah.
Also, radiation tissue damage, like osteoradionecrosis, where bone gets damaged by radiation therapy. HBO can help it heal.
Right, a side effect of cancer treatment sometimes.
Refractory osteomyelitis, it's a bone infection that just won't clear up with antibiotics.
Stubborn infection.
Very. Sensory neural hearing loss sometimes. Sudden hearing loss can be treated. And thermal burns. Severe burns.
Okay, so that's the full list of uses backed by strong evidence, at least according to the U.S. guidelines.
That's the core list, yes.
Yeah. But like I said at the start, I know there's a lot more going on internationally, right?
Oh, definitely. When you look at the literature from other countries, the range of conditions where HBO is being tried or used is much wider.
Wider, but maybe less proven.
That's the crucial point. For many of these international uses, the level of proof from big controlled studies just isn't there yet. It's often based more on, say, clinical experience or ongoing research.
So doctors are using it, they think it helps, but the definitive science is maybe still catching up.
Exactly. But some of these uses are really intriguing. They hint at where things might go.
Like what? Give us some examples.
Well, it's being looked at to help with rehabilitation for things like spastic hemiplegia after a stroke or paraplegia,
Helping recovery.
yeah, or chronic myocardial insufficiency, heart not pumping well, and peripheral vascular disease, poor circulation. The idea is maybe the extra oxygen helps damaged tissues recover function.
Using oxygen to boost the body's own healing. Interesting idea.
It is. It's also used sometimes for asphyxiation cases, drowning near hanging, smoke inhalation, again, trying to counteract that oxygen starvation.
Okay.
And surprisingly, perhaps, dentistry.
Dentistry, really?
Yeah, for severe gum disease, refractory periodontitis. That isn't responding to normal treatment. And maybe helping dental implants succeed in jaws that have had radiation.
Wow. Okay, didn't see that one coming.
Shows how people are thinking about oxygen's role, doesn't it? Other areas include endocrines, like diabetes, maybe helping with wound complications there.
Right.
Making tumors more sensitive to radiation therapy. That's being explored.
So using it alongside cancer treatment.
Potentially.
Right.
And neurology, looking at stroke, multiple sclerosis, even migraine.
Migraine. Okay, that's another surprising one. The range is huge.
It really is. Obstetrics, too, for complicated pregnancies. Things like diabetes during pregnancy, eclampsia, or if the baby isn't getting enough oxygen.
Wow.
Ophthalmology, eyes. For inclusion of the central retinal artery, a blockage that can cause sudden blindness.
Serious stuff.
And ENT, ear, nose, and throat. Reports for sudden deafness, acute acoustic trauma noise, damage Meniere's disease.
Right.
Even some other poisonings beyond CO and cyanide, like hydrogen sulfide, carbon tetrachloride, soft tissue sports injuries, and certain stubborn infections like fungal ones, or even leprosy in some reports.
It really sounds like globally, people are pushing the boundaries, seeing what else HBO might do.
There's definitely a lot of exploration.
But given that the evidence is still developing for some of these, it really hammers home why we need to know when not to use it or when to be super careful.
Absolutely. Which brings us to contraindications, things you shouldn't do.
Right. Are there any absolute no-goes?
There's one main absolute contraindication.
Yeah.
Untreated tension pneumothorax.
Okay, explain that. Tension pneumothorax.
So imagine your lung collapses and air leaks into the chest cavity but can't get out. It builds up pressure.
Tapped air.
Exactly. It squashes the lung, can even affect the heart.
Yeah.
Putting someone with that into a high-pressure chamber would make it much, much worse.
Yeah.
Very dangerous.
Right. The outside pressure would just add to the internal pressure. That makes total sense. A definite don't.
A definite don't unless it's treated first.
Okay. So beyond that absolute one, there are relative contraindications. What does relative mean here?
Relative means you have to weigh things up. The potential benefit of the HBO therapy versus the risk from the patient's other condition.
A risk-benefit calculation?
Exactly. Is the good likely to outweigh the potential harm for this specific person?
Okay. So what kind of conditions fall into that be careful category?
Well, upper respiratory infections are one. Colds, sinus infections, that sort of thing.
Why so?
The main worry is aortic barotrauma ear damage from the pressure and sinus squeeze. If your tubes are blocked because you're congested, you can't equalize the pressure easily.
Like on an airplane, but worse.
Potentially, yes. Pain, pressure, maybe even eardrum issues.
So it's all about equalizing pressure.
A lot of it is. Another one is emphysema with CO2 retention. With emphysema, you have damaged, overinflated air sacs in the lungs, like weak spots, called bullae.
Little balloons?
Kind of. And the worry is the pressure change in the chamber could cause one of these to rupture.
Causing a collapsed lung.
A pneumothorax, yeah. That's why pretreatment chest x-ray is often important to check for large bullae.
What if the x-ray shows those blebs or cysts, but the person doesn't have diagnosed emphysema?
Still a relative contraindication. Same basic concern, pulmonary barotrauma, lung injury. Air could get trapped during compression, expand on the way out, pop.
Right.
But interestingly, the evidence here is a bit nuanced. A survey found many centers do treat patients with these carefully, and the actual rate of problems seems quite low.
So it's a risk, but maybe manageable in some cases.
It seems so. It needs careful consideration. Same goes for a history of chest surgery or ear surgery. You'd want to check things out thoroughly before pressurizing those areas.
Makes sense. What about having a high fever?
Uncontrolled high fever is another one. The concern there is an increased risk of seizures. Ideally, you'd want to get the fever down before elective HBO.
Okay. And pregnancy, that seems like a big one.
It is a very sensitive area. Some animal studies suggested potential risks, especially early in pregnancy. High oxygen under pressure.
So, caution.
Definitely. But if the mother's life is in danger, say severe CO poisoning, then saving the mother is the priority, because the baby depends on her.
The benefit outweighs the potential risk in that emergency.
Exactly. And treatments later in pregnancy seem to carry less risk. There are many cases of successful treatment for the mother without harm to the baby in those critical situations. Again, it's that risk-benefit balance.
Understood. And the last relative one you mentioned was claustrophobia.
Yeah, fear of enclosed spaces. Being in a pressurized chamber can understandably trigger that.
I can imagine.
It can cause real anxiety, panic attacks, make the treatment difficult or impossible for the patient. We'll talk more about managing that when we get to complications.
Okay. Now, it's interesting how things change, right? Some things that used to be seen as contraindications maybe aren't viewed the same way now.
Yes, definitely. Our understanding evolves with research. Take seizure disorders, for instance.
Used to be a big worry.
It was, but now we know seizures during HBO are actually rare, especially at the moderate pressures often used for neurological conditions like around 1.5 atmospheres.
So, lower pressure, less risk.
Right. And sometimes HBO might even help prevent seizures in certain brain conditions by improving oxygen supply. There are even some reports suggesting improvement in kids with epilepsy, though that needs more research.
That's quite a turnaround. What about cancer, malignant disease? Any concerns there?
There was a theoretical worry, could extra oxygen fuel tumor growth?
Yeah, that makes intuitive sense to worry about.
But the current medical view, generally, is that active cancer is not a contraindication. In fact, like you said, it's sometimes used with radiation therapy to make it work better, or to heal radiation damage afterwards.
Okay, so that concern has largely been put aside by evidence?
Seems so. And the last one is optic neuritis, inflammation of the optic nerve.
What was the worry there?
That the oxygen might worsen the inflammation? But many patients with multiple sclerosis who often have a history of optic neuritis have had HBO without issues.
No worsening reported.
Not really. There was even a case report following someone for 40 treatments, no negative effects on their vision related to their past optic neuritis.
Yeah.
So again, the initial concern might have been overstated.
It's really good to see how science refines our understanding. Okay, let's flip the coin now. Complications. What can actually go wrong with hyperbaric oxygenation?
Right, this is crucial, because while it's generally safe when done right, like any medical treatment, there are potential risks. Things patients and doctors need to know.
And top of the list seems to be ear problems.
Absolutely. Middle ear barotrauma. That's the most common reported complication by far.
Barotrauma pressure injury.
Exactly. Trouble equalizing pressure between the middle ear and the chamber can cause anything from just fullness or discomfort
To actual pain?
to significant pain, yeah. Even temporary hearing loss, or sometimes a ruptured eardrum. Studies suggest maybe up to 17% of patients get some ear pain.
17%. That's not insignificant. Are some people more prone to it?
Yeah, research identified some risk factors.
Mm-hmm.
Being unconscious is one, obviously. Can't equalize then.
Right.
Being older, over 60, having cardiovascular disease history, or any sensory problems around the ear. But it's still hard to predict perfectly who'll need preventative measures, like ear tubes.
So even knowing the risks, it's tricky. What can be done to prevent it or manage it?
Well, patients are taught techniques to equalize pressure, like pinching your nose and gently blowing the Frenzel maneuver.
Okay.
Also, just going slower with the pressure increase, especially at the start, helps a lot. Reduces the incidence quite a bit.
Slow and steady.
Pretty much.
Yeah.
Some places might suggest nasal decongestants beforehand, but the evidence for how well they work is a bit mixed.
Right.
And in some cases, especially if someone's intubated, they might do a tiny incision in the eardrum, a myringotomy, to help equalize. But that's not standard everywhere.
Are there any lingering ear issues afterwards sometimes?
Occasionally, yes. Things like ear discharge otorrhea.
Yeah.
Or rarely, the eardrum perforation doesn't heal properly, especially if someone already had issues with their eustachian tube.
The tube connecting the ear and throat.
That's the one. There's also a newer technique using a modified IV cannula to make a tiny hole for pressure relief. Seems quite successful and often heals on its own.
Sounds promising. What about sinus pain? Similar issue.
Very similar mechanism, yeah. Sinus squeeze. If a sinus is blocked, pressure builds up inside as the chamber pressure increases, usually the frontal sinuses in the forehead.
Ouch.
Can be quite painful. Again, decongestants might help. Slow compression is key. And if someone has a bad cold, maybe postpone elective treatment if possible.
Okay. Moving away from just pressure issues, what about other effects? Vision, you mentioned.
Yes, ophthalmological complications. The most common is reversible myopia nearsightedness. It goes away afterwards.
Usually, yes, within weeks or months after finishing the treatment course. More seriously, cataracts are a potential long-term risk with lots of repeated treatments over time.
Ah, okay.
And there's a theoretical concern it could worsen some pre-existing eye diseases. Less common things noted include keratoconus, macular degeneration, retinal oxygen toxicity.
Damage from too much oxygen.
Potentially, yes. And in premature babies, historically, retinopathy of prematurity was a risk, though protocols now aim to prevent that. Free radicals generated by the high oxygen are thought to play a role in some of these eye issues.
Right. Oxygen is good, but too much can cause oxidative stress.
What about the lungs? Any direct risks there?
Two main things: acute pulmonary oxygen toxicity and pulmonary barotrauma.
Okay, toxicity first.
That's more likely at really high pressures, say above 3 atmospheres, for a long time. It seems linked to the same things that cause oxygen seizures in the brain.
How does it affect the lungs?
It seems to involve a sudden spike in blood pressure in the lungs, maybe triggered by the nervous system reacting to the high oxygen, potentially leading to fluid leaking into the air sacs.
So, a systemic reaction hitting the lungs?
Pretty much.
Yeah.
Pulmonary barotrauma, though, is like the ear and sinus issue, physical injury from pressure changes.
Lung tissue damage.
Right. It's less common at the usual treatment pressures, below 2 atmospheres. But if air gets trapped during decompression, the lung can overexpand and rupture.
Leading to serious problems.
Very serious. Air embolus, bubbles in the blood, mediastinal emphysema, air trapped around the heart, or that tension pneumothorax we talked about.
And hard to spot in a single-person chamber.
Can be very tricky to detect and manage quickly there, yes. It's rare, but has happened even in unconscious patients getting treated for CO poisoning, so monitoring is key.
Okay. And oxygen seizures. You mentioned those are rare.
Relatively rare, yeah.
Oh.
One big study found only 2 cases in over 80,000 treatments, and those were at a higher pressure, 2.4 ATA.
So sticking to lower pressures helps.
Definitely. Lower pressures, like 1.5 ATA, and shorter sessions really minimize the risk if one does happen in a multi-place chamber.
Where staff are inside.
Right. The first step is get the oxygen mask off the patient. Medication like phenobarbital might be used. And crucially, don't decompress suddenly during a seizure that risks lung injury.
Got it. Okay, what about decompression sickness itself, the bends? Can that happen from the therapy?
Very unlikely during standard HBO therapy. DCS is more about rapid ascent from deep pressure, like diving.
So not typical therapy profiles.
Not at all. The risk is maybe slightly higher for attendants breathing compressed air inside the chamber for long periods if decompression isn't managed properly. There was that awful historical accident in Hanover at high pressure.
A warning sign?
A stark warning, yes. But thankfully, nothing like that reported in recent years with standard therapy protocols. Controlled, gradual pressure changes are key.
Now, the genetic effects part, that sounded complex. What's the bottom line there as far as we know?
It is complex, and research is ongoing. Some lab studies suggested HBO might cause some temporary DNA strand breaks.
Damage at the DNA level?
Potentially, yes. But other studies suggest cells, like the ones lining blood vessels, can repair this damage pretty quickly.
So the body fights back.
It seems so. There's even some suggestion HBO might protect against other types of DNA damage sometimes. One study found more breaks after the first session, but then things normalized, maybe even adapted, with more sessions.
An adaptive response. Interesting.
Yeah, but then another study suggested longer treatment courses might lead to more chromosome aberrations, bigger genetic changes. So maybe an indirect effect over time. And interestingly, professional oxygen divers seem potentially more resistant to this kind of damage. So overall, yes, there are changes happening at the cellular level.
But the long-term significance?
It's still not fully clear, especially regarding any risk of passing on changes. It's an active research area.
Definitely one to watch. Okay, back to more immediate issues. Claustrophobia. We said it's a relative contraindication, but how is it managed as a complication?
Yeah, it's a big reason people might refuse treatment or stop early, especially in the smaller single-person chambers.
The monoplace ones?
Right. In the bigger multi-place chambers, it might be less of an issue. If someone knows they're claustrophobic and needs elective HBO.
Plan ahead.
Definitely. Talk about it, maybe use relaxation techniques, perhaps medication, sometimes even a trial run in the chamber can help ease the anxiety.
And just general anxiety, not full-blown claustrophobia.
That can happen too, especially with the first few treatments. It's a strange environment.
Confined pressure changes.
Exactly. So good communication from the staff is vital. Explaining everything, reassuring the patient, making sure they can signal if they're uncomfortable, that helps a lot.
The human touch is important. And finally, a really key point. Not everything bad that happens in the chamber is because of the chamber.
That's incredibly important. Remember, people getting HBO often have serious underlying health problems already.
Right. That's why they need the therapy.
So unfortunately, coincidental events can happen. A stroke, a heart attack, a seizure that's unrelated to the oxygen. They could occur just by chance while the patient is undergoing treatment.
So don't jump to conclusions.
Exactly. Always need a proper medical evaluation to find the real cause. Correlation isn't causation.
Absolutely. Okay, as we wrap this up, let's talk precautions. What should medical teams keep in mind when selecting patients?
Well, it differs a bit between emergencies and planned elective treatments.
Emergencies are different.
Right, you might not have time for extensive checks. But for elective therapy, a thorough evaluation is crucial.
What does that involve?
Detailed history, asking specifically about past chest or ear operations, a recent chest x-ray, maybe lung function tests, and definitely checking the eardrums.
Looking for those potential problems we discussed.
Exactly. And there are a few specific situations needing extra caution.
Like what?
Someone with a large skull defect, where the scalp is caved in HBO, might not be safe due to pressure effects.
Okay.
And implanted devices are a big one. Pacemakers, defibrillators.
Need to check if they're safe under pressure.
Absolutely. Most modern ones are fine at standard HBO pressures below 3 ATA. But older ones or temporary pacemakers could fail. Always verify the model.
What about other implants, like medication pumps?
Intrathecal pumps, delivering meds to the spinal fluid. There's a potential issue around 2 atmospheres where the pump might temporarily malfunction, or spinal fluid could leak into it, affecting the drug dose. Need to be aware of that.
So really knowing the patient's full picture is key.
It's paramount. Understanding contraindications, both absolute and relative, taking precautions based on the individual, knowing the potential complications, that's all vital for using HBO safely and effectively.
Okay, so bringing this all together, this deep dive really shows HBO therapy is, well, it's a powerful tool, isn't it?
It can be, yes.
With specific proven uses, but also this wider range of things being explored, and crucially, a clear set of risks and reasons not to use it that need careful thought.
That's a good summary. It offers real benefits in the right situations, but it's not risk-free. Understanding all those factors is key for everyone involved.
Yeah. It seems the main message is serious problems are generally not common with moderate pressures and following the rules, but risks exist, especially related to the patient's underlying illness or implants.
Exactly. Stick to the contraindications, select patients carefully, take precautions. That's how you maximize safety and get the benefits.
And looking ahead with all this research into how it works at, like, a cellular level, even genetically, it makes you wonder, doesn't it? What's next?
It does.
What new things might it help with? How will our understanding of the risks keep evolving? It's this really interesting mix of established medicine and ongoing discovery.
A fascinating field for sure.
Well, thanks for taking this deep dive with us today.